The treatment, just like asphyxia, if you were asphyxiated with a plastic bag over your face, the treatment is get a pair of scissors, cut the plastic bag, and start breathing oxygen. But it's hard. Now you've got billions of little red blood cells that have carbon monoxide on them, blocking the oxygen. It isn't easy to figure out how to get that carbon monoxide off so that the red blood cells can present oxygen. So one of the ways is that you give oxygen an advantage in competing with the carbon monoxide. You give more and more oxygen so that it can compete for the red blood cells with the carbon monoxide and actually knock off some of the carbon monoxide from the red blood cells and replace them with oxygen. So that has been the current form of treatment, giving as high a concentration of oxygen as possible. And if you can't give any higher concentration, if you give oxygen at higher pressures, then the concentration of oxygen goes up. And to get the higher pressures, you basically have to put the person into a special room called a hyperbaric chamber. It's like a submarine, completely enclosed, and you pump oxygen to that, increasing the pressure inside this chamber. And this helps drive some of the carbon monoxide off. And until recently, those were the only possible treatments. And neither are effective. The oxygen gets rid of carbon monoxide to some extent, more than just breathing room air, but not enough to give you a rapid recovery so that you don't get brain damage in most cases. The hyperbaric works reasonably well, but as I said, time is brain. There aren't very many hyperbaric chambers anywhere in the world. Even in places like Toronto, where we are right now, there's possibly one hyperbaric chamber in one hospital with a metropolitan area population of maybe 6 or 7 million people. It's very hard to get there from anywhere else in the province. And it turns out that even if you do get to the hyperbaric chamber with the patient, it takes about 2 hours to get them into the hyperbaric chamber. And would that help them? Let's think about it. If instead of carbon monoxide poisoning, they were being asphyxiated with a plastic bag, that's the equivalent of having them sit in the emergency department for 2 hours before you cut off the plastic bag off their face. That is probably futile. And all the studies that have been done around the world, Australia, France, Canada, and the United States, have shown that the hyperbaric chambers are not helpful. It's not that they don't work, they do work. They get the carbon monoxide off the red blood cells, but they do so late. So to go back to the analogy, it's not that scissors don't cut off plastic bags from people's faces, but after 2 hours, there's almost no point in it. And that's exactly the problem with the hyperbaric chamber. The only treatment for carbon monoxide is to have something that is readily available, that you can apply immediately, that's highly effective. If you don't have that, everything else is futile. And by and large, everything up until now has been completely futile for that reason.